It's just over 1 year since I was diagnosed with hemochromatosis. And since so many of you have shared your journeys of diagnosis with me on this channel, I thought it was about time that I sat down, had a cup of tea and shared my story with you too. What I'm hoping is that this video will show that healthcare professionals are only human too, and we often also make mistakes. I think a lot of us don't always prioritize our own health. We think that certain things will never happen to us and we push off those doctor's appointments to lower down the priority list. And that's exactly what I did. Sometimes as a dietitian, I find I'm so busy looking after other people's health and encouraging them to go to the doctor and check their bloods that it just becomes lower down my personal to-do list. So today I'm going to share the events that led to my diagnosis last year and how I've been getting on since. If you're new to the channel, I'm Maria and I'm a registered dietitian and I make nutrition education videos, one of which was diet and iron overload, a topic that many people with hemochromatosis are curious about. So I'm Irish, if you have not already guessed by the accent. And in Ireland, we have the highest rate of hemochromatosis in the world, which is why it's sometimes known as the Celtic Curse. But it can affect people of all ethnicities. It's just more prevalent in those of us with Celtic roots. Like right now, I live out in the Caribbean, and I thought I would be the only person on the island that I live getting hemochromatosis treatment, but surprisingly I'm not. And even from the comments in my diet and iron overload video, I've learned that people from all over the world have this condition. So to start off, I'm going to backtrack around 15 to 20 years ago. And this was when my dad got diagnosed with hemochromatosis. Now, I was only around 10 years of age at this time. So naturally, I did not have a big knowledge base on health or medical conditions or diet. What I remember at this time was being sat down and being told that my dad had a very serious lifelong condition, but that I didn't need to worry because it was treatable. Naturally, parents never want their kids to worry about their own health. And now, delving back into my dad's family history, this all makes a lot of sense. It seems like a lot of his previous generations also had this condition, but due to the lack of awareness back then, they went undiagnosed. And I remember my dad's journey to get diagnosed took a very long time. My dad would not be one to complain if he ever didn't feel well, but there was a period where he was constantly complaining of headaches and extreme tiredness, which was not like him. And I remember he went to lots of different doctors and there was no answers being found until eventually hemochromatosis was diagnosed. Now, I do think in Ireland there is a lot more awareness of the condition now and people do get diagnosed and it gets picked up quicker. But I know from the comments in my video that many people go a really long time without being diagnosed. But once he got his diagnosis and he started treatment, he immediately began to start feeling so much better. Now, usually when someone gets diagnosed with hemochromatosis, other relatives should then also get tested. But we were all very young at this time and not showing any symptoms. Like, as I mentioned, I think I was only around 10 years of age. Now, my older brother did get tested and he was found to not have the condition, but he was a carrier. And for context, I have 3 brothers and 1 sister. And over recent years, all of my brothers would have been tested at some point. And in fact, so was my younger sister. But I never was. Possibly a lack of my own initiative, but also unfortunately hemochromatosis is often thought of as very much a male condition, even though it is not, but it's because women tend to lose blood monthly through menstruation, and because of this we tend not to present with symptoms as early. But there were 2 events that happened to me that made me believe that I was completely on the other side of the spectrum in terms of my iron levels, that I was actually probably really low, but I was wrong. I'm going to pause here and ask that if you're enjoying the video so far, I would really appreciate it if you hit the red subscribe button below. It really helps support my channel so I can continue making more videos like this one. And if you're looking for healthy, high protein recipes that usually don't have much iron in them, make sure to follow me over on Instagram. So the first one was there was one point in secondary school or in college where I went to donate blood at a blood bank and I was allowed to give blood. But they almost turned me away because I was just about on the threshold in terms of my weight and my hemoglobin, which is something they always check before taking somebody's blood at a blood donor clinic. So in my head, I was like, oh, that's so funny. My dad has high iron and I must be on the other side of things. But this was my own ignorance because hemoglobin is not a useful indicator in terms of hemochromatosis. Then a couple of years after that, I was volunteering at a hospital in Uganda. And I have the universal blood type O negative. So anyone can take my blood and it's really useful for emergencies. Good for others, but not so good for me. But there was a baby in the hospital that needed a large blood donation. And in the area of Uganda that we were in, the baby's family could not donate blood because it would be against their religious beliefs. So the medical team at the hospital asked the volunteer group if there was any O negative blood types amongst us. And there was me and one other. However, the other person had actually given blood in another emergency situation the week before. So I stepped up to volunteer and I was delighted to be able to do this. However, the whole experience knocked me a small bit because I didn't faint, but I almost fainted. And this has never ever happened to me in my life before. It was probably a combination of being in a different environment and taking more blood than normal. But I just remember my vision going slightly blurry, and whilst I was donating blood, I had to be laid back with my legs elevated, and losing vision like this, even just temporarily, was something that had never happened to me before, and it did just knock me that little bit. Now I was completely fine, and within a few minutes, I was okay again, and I completed the blood donation and was able to save the baby's life. But again, I just took this experience as presuming that I was definitely not high in iron. Again, not even fully thinking it through. But from these two encounters, I just had it in my head that I didn't have hemochromatosis, even though I had never had the actual genetic test. I also have never really had a diet very high in red meat because it's just not something that I overly like. And as a dietitian, I see iron deficiency all of the time, particularly in women. So I can only explain the whole situation as having blinkers on. So moving on to diagnosis. So just over a year ago, I quit my job, I moved country, I moved in with my now fiance for the first time, and I basically made a whole lot of huge radical life changes within the space of a month. And I was feeling really exhausted, like all of the time. But I just put it down to all of these changes that I had made. And for context, I moved to Bermuda, which if you don't know is an island off the Caribbean in the Atlantic. And because it's an island, a lot of the food has to be imported. So whilst I was settling in, I was finding it difficult to find foods that I liked because I was used to the amazing food that we have in Ireland. Now we do have amazing food in Bermuda, but it just took a little bit of time for me to figure out what foods I liked, and a lot of the brands in the stores are American brands that I wasn't familiar with. So as a dietitian, I felt maybe my tiredness could be attributed to the fact that my diet isn't as good as it normally is. And in certain situations, I recommend clients to take a multivitamin if their diet is not optimal. So I started taking a multivitamin myself as a little top-up whilst I was navigating this new food scenario and trying to find foods and meals that I liked. And I was taking this for about 2 months. And it was a general women's multivitamin, which of course contained iron. And I've never regularly taken multivitamins before. And this is a really good example of why you should only take vitamins or supplements if you know what you're taking and why. Anyways, after a few months of settling in, I then went and had a general medical appointment and got all of my bloods tested. And now I've always been pretty healthy, so I didn't really expect anything to come back. But I was actually working in the hospital that I got my bloods done at the time. So I was able to tick off my lab form, and I requested that I got a full panel of all my iron studies tested, which of course included ferritin and your transferrin iron binding capacity, the bloods that are important for diagnosing hemochromatosis. And now I ticked these off, not really expecting anything to come back, but as a dietitian, I ticked everything. I wanted to know my vitamin D, my B12, and all the labs that I could, because I hadn't had them done in a while. And when I look back now, I am so glad that I took this lab form and I ticked all the boxes, even though I probably wasn't supposed to. But I got a shock, and my doctor was also very confused when they came back, which then prompted my doctor to request I go back and get the genetic test done, which came back as positive. Now, I was very lucky that my ferritin, which is like your storage iron, wasn't crazy high, as I've had a lot of people comment on my last video with very high numbers. And thankfully mine were nowhere near as close to some people's, but they were still high and the diagnosis was confirmed. So being in the patient's shoes rather than the healthcare professionals for a change was quite different, and I was upset when I got diagnosed because it is a lifelong condition. Although it is highly treatable, it is just a big shock when something like this happens. In one sense, I was also relieved though, because I couldn't explain or understand the exhaustion that I was experiencing, and now I had a possible reason and a possible fix for it. So I started my treatment pretty quickly, got my phlebotomies to get my ferritin down to normal. And I also had an MRI on my thyroid because some of my other bloods were off, and iron can deposit on your thyroid, on your liver and on your heart. And thankfully everything was fine. But it is good practice when you do get diagnosed to have all of these other things checked to check if there has been any other damage after occurring. Now, I'm always asked about iron in the diet, and being a dietitian, it's something that is very important to understand with this condition. But diet really is such a small part of hemochromatosis treatment. The main thing really is your regular and venesections. And this is why I've made a full video on this. So make sure you do watch this to learn more. Regarding my diet, I did not change very much because I don't tend to eat a lot of red meat, just because I've never really overly liked it. But that said, if my mom made a lasagna or there was a place I went to that was known to have the best steak ever, I would of course try it, because it's not like I'm consuming these every single day. And again, a diet is only a small piece of the puzzle. I do check foods to make sure they're not fortified with iron, because that can be added in a lot, because iron is in fact the most common deficiency worldwide. But one thing that I am very conscious of is alcohol. We all know that alcohol is not good for your liver. And if you have hemochromatosis, you need to be even more careful, because your liver is that little bit more sensitive. But also, many people don't know this, but alcohol can contain a significant amount of iron, more iron than food in some situations. So nowadays, if I'm in a social situation, people are drinking, I don't completely avoid alcohol, don't get me wrong. If I'm at a wedding or I particularly want a glass of wine, I will have it. But for the most part, I don't drink very regularly. I'm quite fortunate in that I never really liked the taste of alcohol, and saying no to it isn't really difficult for me. But it is something that I would encourage people to not be doing the dog on, especially if you are Irish. The other change that I made after being diagnosed was I purposely put on a small bit of weight, because it was just easier for me. As anyone who has the condition will know, giving blood can take a lot out of you. And the smaller you are, the smaller blood volume you have. And draining a pint of blood from a very small person is a lot more exhausting. And I do think that has helped me a small bit. Now, although diet is not a big part of hemochromatosis treatment in itself, a healthy diet is really important for your health, particularly your liver or your heart or any other organ that may have been impacted by iron overload. And I think that being diagnosed with hemochromatosis can be an opportunistic time. It can be a wake-up call where people now become much more motivated to look after their health. So use that to your advantage if you have been diagnosed, because you might be more motivated now than ever to make positive, healthy lifestyle changes. And I also want to say that although hemochromatosis, it is highly treatable, it is a lifelong condition, and it is not something you can ever forget about or not take seriously. And being diagnosed myself has made me a much more vigorous advocate for others with hemochromatosis. I'm frequently reminding all of my family and all of my clients to keep up to date with all of their regular venesections, and urge all first-degree relatives to get tested too. Don't fall victim to being too busy or pushing your health-related tasks further down the to-do list. We cannot forget about our health. Now, I'm really starting to ramble on now, so I'm going to wrap up, but I am planning on making another video over the next few weeks or months about frequently asked questions in terms of hemochromatosis and diet and diagnosis, because I've had a lot of questions on my last video that I want to address. So if you have any questions that you would like me to answer or look into for you, please comment below and I will do my best to include them in that video. Thank you very much for watching. Stay happy and healthy, and I'll see you again next week. Thanks for watching.